All right, today we're diving into something incredibly intense and really critical, the world of managing severe burn injuries. And trust me, this is about so much more than just a wound on the skin. It's a full body medical crisis. We're going to follow the whole journey, step by step, from the very first moment of injury all the way through the long, tough road to recovery.
So we've broken this down into 5 key parts. First, we'll get into what makes these injuries so uniquely dangerous. Then you'll see how medical teams literally race against the clock to assess the damage. We'll cover those critical first hours of care, then the long road to healing, and finally, we'll talk about the most powerful tool of all, prevention. So let's get right into it.
First up, we really need to understand what a severe burn actually is and why it goes so much deeper than just the skin. So what's the big deal? What actually elevates a burn from, a painful injury into a full-blown, life-threatening emergency? Well, the answer goes way, way beyond the surface, and it affects pretty much every single system in the body. Okay, so here's the textbook definition. It's an injury to tissue, and it can come from a lot of different sources. But the real key here, the thing you have to understand, is that the initial injury triggers this massive, body-wide inflammatory response, and that is what kicks off the entire crisis. When you think of a burn, you probably picture fire, right? But look at this. The most frequent cause is actually thermal, which includes things like steam or scalding hot liquids. And while chemical and electrical burns aren't as common, they create their own unique and devastatingly complex injuries. Okay, so that leads us right into our next section, assessing the damage. In a burn emergency, the clock is absolutely ticking, and getting a fast, accurate assessment can be the difference between life and death.
So imagine you're a first responder. What's the very first thing you do? You calculate one critical number, the percentage of total body surface area, or percent TBSA, that's been burned. Seriously, this one number pretty much dictates the entire game plan, especially the massive amount of fluid the patient is losing and will desperately need replaced.
But how in the world do they figure that out so fast in all the chaos? Well, they use this really clever tool called the rule of nines. For adults, the body is basically broken down into sections that each represent 9%, or a multiple of 9. In the middle of an emergency, its speed and simplicity are absolute lifesavers. Okay, your turn. Let's do a quick pop quiz. Take a look at this scenario. Based on what we just learned about the rule of nines, can you add these up? What do you think the total TBSA is? Did you get 31.5%? If you did, you nailed it. And this shows you just how fast a medic can get a working number to guide what they do next. 18 plus 9 plus 4.5. Boom. There's our critical starting point. But, and this is a big but, that TBSA number isn't the whole story, not even close. A 5% burn on the back is one thing. A 5% burn on the face that could shut down their airway, totally different ballgame. Same for hands or joints. The depth of the burn and the patient's overall health are also absolutely critical pieces of the puzzle. And that initial assessment kicks off what is, without a doubt, the most dangerous part of this whole journey, the first 48 hours. This is called the emergent phase, and it is a pure, desperate fight for survival. Think of this timeline as our roadmap. It all starts with that emergent phase. Those first 48 hours are just about keeping the person alive. Then comes the acute phase, which can last for weeks, where the focus shifts to healing and fighting off infection. And finally, you have the rehabilitative phase, which can take months, sometimes even years, as the patient works to get back their function and quality of life. Okay, so in these first 48 hours, there is one monster they are fighting above all else: burn shock. Here's what's happening. The burn makes all the tiny blood vessels, the capillaries, start leaking fluid like crazy. Imagine your entire circulatory system is a hose just full of holes. All that fluid pours out, your blood pressure tanks, and that's a state called hypovolemic shock. It is absolutely deadly. Which brings up a huge question. How do they know exactly how much IV fluid to pump back in? It's a terrifying balancing act, right? Too little fluid, and the patient dies from shock. But too much fluid, and you could drown their lungs or overwhelm their heart. So how do they get it just right? The answer isn't guesswork. It is pure, precise math. It's called the ABA fluid resuscitation formula. They don't just grab any IV bag. They use a specific fluid, lactated ringers, that's really similar to our own blood plasma. Then they use this formula, multiplying a constant by the patient's exact weight and that TBSA percentage we figured out to get the exact amount of fluid needed over the next 24 hours. And it's not just about the total amount. It's about the timing. The timing is absolutely everything. They push the first half of that entire volume in the first 8 hours, starting from when the injury happened. The rest is given more slowly over the next 16 hours. It is an incredibly precise and controlled race against time. So if they make it through that initial crisis, if they're stabilized, the fight isn't over. Not by a long shot. The journey just shifts. Now we enter the long road to healing, which covers both the acute and rehabilitative phases. And you can see that shift crystal clear right here. The battle against shock is won for now. But now there are new enemies on the field: infection and malnutrition. The new goals are obsessive wound care, getting pain under control, and just fueling the body for the enormous, enormous task of healing itself. And fighting those new enemies requires a whole new playbook. We're talking constant, meticulous wound care and something called debridement. That's the painful but totally necessary removal of dead tissue. To stop infection, those wounds have to be closed, often with skin grafts. All of this is happening while the team is also managing just extraordinary levels of pain and trying to feed a body that's burning calories like a blast furnace. But the healing, it's never just about the skin. As we get into the rehabilitative phase, the psychological trauma really comes into focus. This quote right here really hits it home. Address self-esteem. Helping patients cope with a changed body and regain their confidence is a huge long-term part of their recovery. Okay, so after seeing everything a burn survivor goes through, it really brings us to the most powerful section of all: how we can try to prevent this from ever happening in the first place. After seeing that devastating journey, these simple safety tips suddenly feel a lot more important, don't they? Things like testing smoke alarms and having an escape plan are so vital. And here's a really big one. Set your hot water heater to 120 degrees Fahrenheit or lower. That one simple step can prevent horrific scald burns, especially in kids and the elderly. So I want to leave you with this one question. We've just followed this incredible, harrowing journey from crisis to recovery. Knowing what you know now, what is one simple safety check you'll make in your own home today?